As you prepare for your joint replacement surgery, Rehabilitation Services will play an important role in your procedure and recovery. During your recovery following surgery, you will have both physical and occupational therapy. Therapist and/or therapist assistants will work with you on learning how to move safely and care for your new joint replacement during your hospital stay. The rehab team will also educate you on any recommended adaptive equipment needed for your care at the hospital and at home. For optimal results after joint replacement, early activity and exercise is critical. Therefore, the role of therapy is to get you up and get you moving. Occupational therapy will focus on activities of daily living such as dressing and bathing, along with recommending any adaptive equipment that you may benefit from. Physical therapy will focus on bed mobility, transfers, ambulation, stairs, range of motion, and strengthening. We'd like to say that this joint replacement becomes your new full-time job for the next few months. If you focus on doing your exercises, going for walks, and participate in your therapy sessions, you will improve your outcome. Please remember, you are personally accountable for at least 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before surgery, and it will need your personal touch to fully recover. Most likely, you will need a walker after your surgery. Therapy recommends a walker that has straight wheels. There are walkers that have swivel wheels, however, those wheels move more freely and may not provide you with enough support. There are also walkers without any wheels. However, these walkers you would have to pick up with each step. If you already have a walker or are able to borrow a walker from someone, you can bring it to the hospital for the therapy staff to make any adjustments. Therapy will adjust the height of the walker to the appropriate height for you and will look it over to make sure it is working properly. Your surgeon may use a CPM machine if you have a knee replacement. CPM stands for Continuous Passive Motion. The purpose of this machine is to help achieve and maintain good range of motion following your surgery. The CPM will move your knee through the designated range. While the CPM is on, all you need to do is relax and let the machine do the work. You will get set up with one of these machines prior to your surgery. Someone from the company will call you and deliver it to your home prior. They will set the CPM up for you so it fits you properly and show you how to use it. You may see a few different pieces of medical equipment, like a knee immobilizer. Knee immobilizers are braces that may be ordered by your surgeon to stabilize your knee. It also helps by keeping your knee from bending. There are times therapy will have you walk with a knee immobilizer on, if there is a question on your muscle's ability to control your knee. These sturdy belts are used by staff members when you get up and move. Another safety device, these belts are used to assist you in regaining your balance if you were to lose it or begin to fall. They also help you stand or transfer if you are still too weak or groggy after surgery. Your bed will likely have a trapeze on it when you return from surgery. By pulling on it with your arms, you can reposition yourself in bed without having to use your legs. Leg lifters allow the arms to assist in lifting your leg in and out of bed. Reachers, dressing sticks, and sock aids. Occupational therapists often recommend these assistive devices to patients that have limited range to enhance their functional independence in daily life activities. Reachers help you by grabbing out of reach items with ease. Sock aids help you by assisting you with putting your socks on, and dressing sticks, for one example, will assist you with removing your socks. Some other adaptive equipment you may be introduced to are long-handled shoehorns, elastic shoelaces, and long-handled bath sponge. Following surgery, you will recover in the hospital and work closely with your entire team to determine the appropriate day for discharge. Pain after surgery is a normal body response. It is our goal to minimize and control your pain as much as possible. However, your pain needs to be at a level that allows you to do your exercises and therapy. This is called functional pain. Functional pain is described as pain that is not gone, but controlled enough that allows you to function during exercises, ambulation, and your recovery. The goal is to minimize and control your pain. Pain goal is 4 to 5 on a scale of 1 to 10. That afternoon or evening, the nursing staff will assist you with sitting up. The nurses will have you sit at the edge of the bed while they monitor you for any blood pressure issues, dizziness, and if you are nauseous. There are occasions when surgery happens early enough in the day. Physical therapy may come in on surgical day and get you started with some exercises, bed mobility, and/or transfers. The morning after surgery, therapy staff will come in. We are typically in your room early the next morning. First, therapy will work on a few exercises that will be discussed later in more detail. Therapy will work with you on bed mobility to get you sitting up at the edge of the bed. Therapy 2 will assess for feelings of dizziness, nauseous, and may check your blood pressure. As long as you tolerate sitting at the edge of the bed, therapy then will have you try to stand up for the first time using a walker for support. In order to stand, first therapy will have you scoot to the edge of the bed so that your feet are flat on the floor. Then prior to standing, you will place your surgical leg out in front of you. And for knee patients, this helps you avoid increased pain by decreasing the bend of your knee. Once standing with your surgical leg out in front of you, then we will have you attempt to stand. Therapy will have you push up from the bed using your arms to assist. You never want to start with your hands on the walker trying to pull yourself up because the walker could tip backwards. This could cause you to lose your balance during mid-transfer, causing you to fall. This could lead to an injury. Once standing, you can move your hands onto the walker and slide your surgical leg back to the other leg to get yourself in a good stance. At this time, if needed, therapy will adjust your walker to the appropriate height. Fitting the walker to your height, therapy will have you stand with a good posture. Therapy will adjust the height of the walker to be at your wrist level. If your walker is not available for therapy to adjust, they will provide you with education on how to make the correct adjustments prior to your discharge. Once the walker is at the appropriate height, therapy will have you do a couple of weight shifts prior to taking some steps. A weight shift is shifting your weight onto one leg, then back to the other. You may not have 100% feeling back in your surgical leg yet, so therapy would like to assess how you tolerate this before taking a few steps. Therapy wants to make sure that your legs will fully support you. As long as you are able to stand safely, then therapy may have you take a couple of small steps to turn. To turn, you will hold onto the walker and take small steps, turning until you are lined up in front of the chair, which is placed beside your bed. To make sure you are lined up in front of the chair, you should feel the chair on the back of your legs. It's important to take a few steps and not pivot on your surgical leg. Prior to sitting down, you will place your surgical leg out in front of you again, just like you did when you stood up. You then will reach back for the armrest and slowly lower yourself into the chair. Just like standing, you do not want to sit with your hands on the walker because, again, the walker may tip back and cause you to lose your balance with an uncontrolled descent, placing you at a higher fall risk or injury. Once therapy sees that you can safely transfer to a chair, you will get up in the chair for all 3 meals. Therapy recommends that you do not sit up for extended periods of time, as this could cause you to get stiff and increase your swelling. After meals, nursing staff will assist you back to bed and place the CPM on your surgical knee if ordered by your surgeon. The CPM machine will start at 0 to 45 degrees range of motion of the knee and will gradually be increased a few degrees daily. It will increase based on your tolerance. You would be placed in the machine for 2-hour increments, 3 times per day for a total of 6 hours, ideally between meals and evenings. The CPM does not count as your prescribed exercises. Therapy will come back to review morning exercises and will start helping you walk based on your tolerance to ambulation. Therapy will take you through several gait or walking patterns. You will have therapy up to 2 times a day. Therapy will progress you daily in your bed mobility, transfers, ambulation, exercises, and stairs prior to discharge. Detailed information on exercises will be addressed later. Remember, up with the good, down with the bad. Prior to discharge, therapy will educate you on how to do the stairs. Therapy will have you go up and down the stairs to simulate your steps at home. After a surgery, you will likely need to take the steps one at a time, which is what some of you may already be doing. We have a golden rule that we tend to follow when going up and down the steps. It is up with the good, down with the bad. This means when you're taking the first step up, you will lead with your good leg first. This is your non-surgical leg. Going down the steps, you will lead with your bad leg first. This is your surgical leg. Remember, one step at a time until your therapist tells you different. After you have knee replacement surgery, you will need to be careful about how you move your knees. Follow these precautions until your surgeon tells you they can be discontinued. Do not sit in the same position for long periods of time. Keep your feet and knees pointed straight ahead. Do not turn your leg or knee in or out. Your knees should be either stretched out or bent in a way your therapist has instructed you. Do not pivot on your surgical leg. Take small steps when you are turning. Your toes should be pointed straight ahead. Do not place a pillow or a pad behind your knee when lying down. It is important to keep your knee straight when resting. If you need to raise or elevate your leg, keep your knee straight. Do not jerk on your surgical leg. Do not kneel on your surgical leg. Do not squat soon after surgery, such as do not squat down to pick up something off the floor. This is not a precaution for total knees, but another reminder for you to sit in a firm chair with a straight back and armrest. Avoid stools, sofas, soft chairs, rocking chairs, and chairs that are too low. This will allow you to get up and sit down easier, decreasing your fall risk. Occupational therapy will be involved to teach you ways to dress while using adaptive equipment and maintaining your knee precautions. You will be discharged from the hospital when your healthcare team feels you are medically ready and you have successfully met your physical and occupational goals. Social services will be addressing this in more detail. Once discharged, physical therapy most likely will be recommended. Physical therapy can continue as an outpatient, home health, or short-term rehab. Outpatient therapy: if you are returning home and have the support team in place, your surgeon may recommend you continue your physical therapy on an outpatient basis. If you qualify for home health services, they will come in and provide therapy within your home. It is up to the agency if you qualify and how many times a week they will provide therapy. Short-term rehab facilities provide the daily skilled nursing care and rehab programming all under one roof. This is ideal for people that don't have enough care support in the home. Short-term rehab provides an option for recovery until you are able to safely return home. You will receive therapies 1 to 2 times a day for 5 times a week if you meet the skilled requirements. To build strength and to aid in your recovery, start doing all your rehab exercises starting today. This will allow you to become familiar with them, which will help you during your therapy sessions. Encourage your support person to go through the exercises with you, as you may need their help after surgery. There will be 4 exercises that therapy will introduce to you most likely the day following surgery. These exercises help keep the blood flowing in your legs, reducing your risk for blood clots. They also help you keep your swelling under control by pushing the fluid out of your legs. During your therapy sessions, the therapist will provide education and assist you with your exercises to make sure they are performed correctly each day. Each day, your therapist may introduce different exercises to progress you in range of motion and strength. Your therapist prior to discharge will provide you with your personalized home exercise program. The first exercise is ankle pumps. Position. Begin lying on your back with your legs straight. Movement. Slowly pump your ankles by bending and straightening them. Helpful hints. Try to keep the rest of your legs relaxed while you move your ankles. The second is supine quad sets. Position. Begin lying on your back on a bed or a flat surface with your legs straight. Movement. Tighten the muscles in your thigh of your surgical leg as you straighten your knee. Hold for 5 seconds, then relax and repeat. Helpful hints. Make sure to keep your toes pointed towards the ceiling during the exercise. Try to flatten the back of your knee towards the bed. This is the third exercise. Begin lying on your back with your legs resting comfortably. Movement. Tighten your buttock muscles. Hold for 5 seconds, then release and repeat. Helpful tips. Make sure not to arch your low back during the exercise and hold your breath as you tighten your muscles. Keep your knees flat. This is the fourth exercise. Position. Begin lying on your back with your non-surgical leg bent and surgical leg straight. Movement. Slide the heel of your surgical leg towards your buttocks, bending your knee as far as it is comfortable. Hold for 5 seconds, then slide it back to the starting position and repeat. Helpful tips. Make sure to keep your back flat on the bed during the exercise. These are the 4 main exercises that therapy will begin with you. The following will be introduced as you tolerate them. Supine hip abduction may require assistance from your therapist if you are unable to move through the complete range and/or perform correctly. I will describe this exercise today with assistance. Most likely, the therapist will need to assist you to achieve the available range and for proper form with this exercise. The position. The patient should be lying on their back. The therapist or caregiver at home should hold the surgical leg below their knee and at the heel. Movement. With assistance, slowly slide the surgical leg out to the side, keeping the toes pointed towards the ceiling. Hold for 5 seconds, then slide the leg back to the starting position and then repeat. Helpful tips. Make sure to perform this exercise slowly and keep the knees straight but not locked. The caregiver should keep their back straight to maintain good body mechanics. Do not force range and always go by pain tolerance. And assess their body language for any signs of discomfort that they might not be sharing with you. Caregivers are there to assist in the motion that you are unable to perform correctly. They are not there to do it all. This exercise, position, movement, and tips will be the same if you can actively do these in a good form on your own. Initially, straight leg raise most likely will require assistance from your therapist during your hospital stay. I will describe this exercise today without assistance. Position. Begin lying on your back on a bed with your surgical leg straight and your other leg bent. Movement. Pull your toes towards your body, keeping your knees straight, and slowly lift your surgical leg off the bed until it is close to parallel with your other thigh. Hold to your tolerance up to 5 seconds, then lower it back down to the starting position and repeat. Helpful tips. Make sure to keep your thigh muscles tight and your knees straight. Do not turn your foot or hip in or out during this exercise. When assistance is needed, the therapist or caregiver will hold your leg below the knee and at the heel while assisting. Remember, exercises should be completed within your pain tolerance. If your caregiver is assisting, they should also be monitoring your body language for any signs of discomfort that you are not sharing. Exercises should be completed slow and with control. Caregivers are there to assist in motion that you are unable to perform correctly. They are not there to do it all. Short arc quad position. Begin lying on your back with a rolled up towel under your knee of your surgical leg with your heel resting on the bed. Movement. Tighten the muscles in your upper leg to straighten your knee. Hold up to 5 seconds, then return to the start position and repeat. Helpful tips. Make sure to keep your back flat against the floor or bed as you move your leg. Calf stretch. Position. Begin lying on your back, holding the end of a strap or sheet that is looped around your foot. Slowly pull back on the strap or sheet, pulling your toes up towards your body, and hold for 60 seconds. You should feel a stretch in the back of your lower leg. Helpful tip. Make sure to keep your leg straight and do not let your foot turn in or out during the stretch. This will help you achieve full knee extension, getting your knee straight. It's just as important to have your knee straight as it is for it to bend. This will help you with your gait mechanics during ambulation. Knee extension stretch with chair. Position. Begin sitting upright with the chair directly in front of you. Movement. Rest your foot of your surgical leg on a chair and then begin to relax your leg, allowing your knee to straighten, and hold this position. Hold this position to your tolerance up to 60 seconds. Helpful tips. Make sure to keep your back straight and keep your foot pointed towards the ceiling. Do not let your foot roll out or in when doing this stretch. This will help you achieve full knee extension. It's just as important to have your knee straight as it is to bend. This will help you with your gait mechanics during ambulation. Seated knee flexion. Knees only. Position. Begin sitting in an upright position with your feet flat on the ground. Movement. Slide your surgical leg backward as far as it is comfortable and hold it for 60 seconds or your tolerance. Then slide your foot back to the starting position and repeat. Try to slide your foot a little further backward each time. You may want to use your opposite leg to assist with increasing your stretch. Helpful tips. Make sure to keep your back straight during this exercise. Do not force the stretch. Stretch within your tolerance. You will have some discomfort, but not so bad that you have increased pain following limiting your activities of daily living. This will help you achieve full knee flexion. That means bending. It's just important to have your knee to bend as it is for it to be straight. This will help with your gait mechanics also during ambulation. If you have steps with no railings, therapy encourages you to have at least one railing installed. 2 would be ideal if possible. Having railings with your stairs will make it easier to enter and exit your home. Remember, up with the good, down with the bad. If your bedroom is upstairs, consider using a main floor room for a bedroom initially. Traffic pattern. Move obstacles such as throw rugs, extension cords, and footstools out of your walkway. Create a wide, clear path from your bedroom to your bathroom and kitchen so you can easily move about with your walker. Bathroom. Install a raised toilet seat in the bathroom, or if you're unable to get on and off the toilet easily. Grab bars, tub rails, and shower chair may be beneficial as well. Install non-slip surfaces in the tub or shower. Sitting. Find a chair to sit in that has a firm, straight-back chair with armrest. A dining room chair may work if you don't have other chairs. Access to items. To avoid reaching or bending, keep frequently used items within easy reach, especially in the kitchen, bathroom, and bedroom. In case you cannot wear pants with pockets when you first return home, consider getting an apron with pockets so you can carry around your phone and other items after your surgery. If you're using a walker, attach a walker bag to the front of your walker to carry items from place to place. It is a good idea to carry a cell phone or portable phone with you at all times during your recovery. Get help with cleaning and laundry when you first return home. Have a few weeks' worth of clean clothes available to you. Small children and pets can pose a safety hazard to your recovery. Small children may need to be taught how to interact with you in ways that keep you safe. If you have pets, make arrangements to keep pets in another area of your home when you arrive. Arrange somebody to collect your mail or place delivery on hold during your stay at the hospital. Arrange for help with your meals and perishable foods. Prior to your surgery, freeze pre-made dinners and other meal items. Stock up on non-perishable foods to make it easier to prepare meals after surgery. You can also call your local Aging, Disability, and Resource Center to see if you qualify for Meals on Wheels delivery. Do not drive until your health care provider says it's okay. Break up long car rides. Stop, get out, and walk about every 2 hours. For total knee replacements, you may need to move the seat all the way back to allow you to get your surgical leg in and out of the car. Make sure to wear shoes with backs on them that can be easily slipped on and off. Do not wear clogs or sandals. Use your walker until your doctor or therapist tells you it's okay to stop using it. Your therapist usually starts you with a front-wheeled walker during your hospital stay. When you are strong enough, your therapist, following hospitalization, will transition you to a wheeled walker, crutches, or cane. Continue your CPM at home with the settings you were on at time of discharge. Gradually increase the range on your CPM to your tolerance. Once again, please remember you are personally accountable for at least 50% of your final outcome. It is your responsibility to achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before your surgery, and it will need your personal touch to recover. In summary, we've talked about a lot of things. We talked about making sure your pain is under control. We talked about making sure you have the right walker. We talked about precautions for total knee replacements. We've talked about the importance of the CPM machine for total knee replacements. And we talked about the importance of the exercises and how you need to start them today to become familiar with them and to increase your strength and range of motion prior to surgery. Therapy would like to say that this joint replacement becomes your new full-time job for the next few months. You are getting this new joint replacement because you want a good outcome, right? So make sure you do your homework. Mile Bluff Medical Center Rehab Department is looking forward to helping you meet your goals. Good luck to you all.